I'm an MRI physicist by training, engineer by training as well. My research is focused on developing new magnetic resonance imaging technologies, particularly technology to look at function of tissue and also looking at the viability of living tissues inside the human body. So the main focus of my research is to extend those imaging capabilities in order to help with earlier, more accurate diagnosis that would lend themselves to more accurate detection of disease and hopefully better treatments. Many diseases really start out with small functional changes. And these functional changes take place long before anatomical, morphological differences start to appear. For example, if people develop tumor, you don't get a huge lump of tumor right at the outset. What happens is you start to get abnormalities at the cellular level, and these cells start to proliferate or grow out of control. So being able to detect these functional changes in the body is really important if we want to diagnose disease earlier on. Also works the same way in terms of monitoring treatment. Is a treatment working? And a lot of times we know that a treatment is working if we can detect functional changes first, because those always proceed before morphology differences occur. One technology that we have really advanced quite a bit is to look at the health of the tiniest blood vessels in our body. And this is really important because it's really the tiny blood vessels in our body that control our blood pressure, that controls flow. If the control mechanisms for the small vessels in our body aren't working properly, a lot of problems can start to develop. And we see these in people with diabetes, with hypertension, and even in heart disease. Our next step is to take it to the heart, to see if we could actually detect problems that are going on outside before the heart is affected. And maybe that will lend itself to an easier cure and treatment. So that's what I'm most excited about, because it's probably something that we'll be able to get into clinical trials within the next 5 years.